I was about to do the 5 o'clock news. In fact, I did the 5 o'clock news, feeling a little bit weird that day, I recall. A little bit not myself, and a little uneasy. And then I did the 5 o'clock news, and I only do a minute at 5, so it was just like a few headlines, da-da-da-da, and I guess I didn't actually realize it at the time, but Dan Green noticed it, and immediately a phone rang. We had a couple of phone calls come into the station. One lady called and said, "He's drunk. Dennis Lenhen is drunk on the air." And then another woman who had a nursing background called and said, "That's not a good sign, get him to the hospital right away."
He was rapidly evaluated, sent for a CAT scan, had some basic labs obtained, and had obviously a comprehensive history and physical done to determine whether this was a true brain attack or a stroke.
They said, "Had an incident, it is regarded as a stroke, and we're going to keep you overnight and do a battery of tests."
Well, it looked like on CAT scan and a subsequent MRI scan that he did have an area of the brain that had suffered a slight injury, causing him to have temporary weakness of the muscles of his face.
I went back and we looked at the tape of me, and sure enough, I was talking like this, and I didn't even realize it at the time. Say it's like an earthquake, but I didn't have much of an aftershock. It's a little twinkly, and the little lightheadedness in your brain is hard to explain what it does. I can't really explain what it did, but you knew there was something going on that you'd never felt before.
You think of stroke as a limitation of blood supply to the area of the brains. The limitation of blood supply come from a few different causes, and we know smoking is definitely one of the ones that narrows the arteries to the brain.
It was kind of a warning, a lifestyle warning for me, because smoking, 25 years as a smoker, and there is a correlation. And I have not had a cigarette since that day. I'm not glad it had happened, but in a way, it was a wake-up call that got me out of some really bad habits. And you know, I should have known, because my father died of a stroke, his father died of a stroke, and the warning signs were probably there, and I was ignoring them. But this made me very aware of how serious it could be. My overall lifestyle has improved, and I don't know why, but in the years since that has happened and things that have happened to me, I've never been happier. I enjoy my job more. I'm not here to speak from the pulpit, but I'm a better person than I was then, and I just feel better. My advice is don't smoke. I wish I would have never smoked ever.